Good day. This is Dr. Dempsey on Call with Doc Dave. And today we're going to have episode number 17, and it's going to be a very common cause in people generally over 50 years of age, but everybody should be aware of this topic, and it's hypertension. Now, what is hypertension? It's a condition where the force of the blood against the artery wall is too high. So in other words, you've got a pump. Your heart is a pump. And when it's pumping blood out of your heart into your system, if you have any type of hardening of the arteries or any type of resistance in your arteries, then that pump has to work harder to push the blood out of the heart during contraction. And that's where your blood pressure numbers go up. You know, a normal blood pressure, maybe 120/80. As that resistance increases that your heart has to pump the blood out of, then your blood pressure is going to go to 140/100 or 160/110, depending on how much resistance the contraction of the heart has to overcome to get the blood from the heart into your system. So, what is they say over 50% of the adults in the United States have an elevated blood pressure. So what number is really considered an elevated blood pressure? Well, the number of 120 is your systolic blood pressure. And that's the maximum blood pressure during the ventricular contraction, the resistance your heart has to push against. The other number, the lower number, is your diastolic blood pressure. And that's the minimum pressure that just prior to the next convulsion, when your heart is relaxed and your heart is refilling with blood. So you've got a systolic number, which is your highest number, the upper number, and you got a diastolic number, which is your lower number. Now, a normal blood pressure is 120/80, as I stated. Now, you can have stage 1 blood pressure, hypertension, which usually goes up from 130 to 139 of the upper number, or your systolic number, and 80 to 89 in your lower number, or your diastolic number. That's primary hypertension. Now, secondary hypertension, which means your number now goes from 140 plus in your systolic number to 90 plus in your lower diastolic number. So that's stage 1 and stage 2 hypertension. Stage 3 hypertension is a hypertensive emergency. That's when your upper number is greater than or equal to 180 and your lower number is greater than or equal to 120. And this can precipitate an acute heart attack or an acute stroke. So if your blood pressure is in that range, you take it at home, you got a reliable blood pressure machine, and you're normally running, say, 140, 160, and normally running, 90 to 100. And then all of a sudden you take your blood pressure and it's 180/120 or higher, then you would need to go immediately to the emergency room, notify your doctor, and get immediate urgent treatment. And usually it'll be either an intravenous antihypertensive medication, or they'll supplement your hypertensive medication with additional oral medication. So those are numbers that you need to know and numbers that you need to be concerned about. Now, what are the causes of hypertension? Well, usually it's dietary, salty foods with water retention. Yeah, because then that puts more water, more blood, more fluid in your system. So in order for your heart to pump out that blood out of your heart, it's pumping against a higher resistance because there's more fluid in your system retained from salty foods. Salt retains fluid into your body. Now, obesity is another problem because now your heart is pushing against a heavier weight in your system. So that's going to cause the resistance to go up as well. There's sedentary lifestyle with no, minimum to no exercise issues. So your body is not performing at a ideal condition. You got a heavier weight, you got a bit higher resistance, you got higher blood pressure. Now, there's also something called a primary hypertension, which there's no specific cause to. Could be family history, could be the stuff I mentioned earlier above, your salty foods, your obesity, sedentary lifestyle, and smoking and alcohol ingestion. And then there's secondary hypertension, which is caused by a secondary medical condition in your system. In other words, you may be a diabetic, you could have chronic renal failure, you can have primary aldosterone problems, smoking, blood pressure pills, birth control pills. These are secondary things that cause your blood pressure to be elevated. So you got primary and you got secondary. Now, what do you do if you've got hypertension? Well, there's complications associated with this, so you got to treat it. And the complications are coronary artery disease leading to a heart attack, CVA leading to a stroke. You got peripheral artery disease are complications. You got kidney disease, which is a big complication, chronic renal failure. You got pregnancy complications, which is eclampsia, which means your blood pressure goes up during pregnancy. You start to get edema, and you can have seizures, and you can lose the baby. Eye damage. You can get vascular damage in your visual system, causing loss of eye visual acuity. And you can have primary dementia associated with this as well. So these are complications that